Since the first case of COVID-19 was diagnosed in December 2019, it has swept across the world and galvanized global action. This has brought unprecedented efforts to practice social distancing in Atlanta, Georgia. This has resulted in changes in local behavior patterns and shutdowns usual to day-to-day functioning. While these steps may be crucial to mitigate the spread of the disease, they will undoubtedly have consequences for Atlanta's mental health well-being in both the short term and long term. These consequences are important because efforts focused on prevention and direct intervention are needed to address the impact on Atlanta's adult population. Large-scale disasters, whether traumatic, i.e. World Trade Center attacks, or mass shootings, natural hurricanes, or environmental deep-water oil spills, are almost accompanied by increases in depression, posttraumatic stress disorder, substance use disorder, and broad ranges of mental and behavioral health disorders. For example, 5% of the population affected by Hurricane Ike in 2008 met the criteria for major depression disorder in months after the hurricane. 1 out of 10 adults in New York City showed signs of the disorder in months following the 9/11 attacks. And almost 25% of New Yorkers reported increases in alcohol use after the attacks. In the context, the COVID-19 it appears likely that there will be an increase in anxiety, depression, substance use, domestic violence, and schools closing. There is a very real possibility of increase in child abuse. This difficult moment in time, nonetheless, offers the opportunity to advance our understanding of how to provide mental health care prevention. The city of Atlanta has a unique opportunity to emerge from the pandemic as a best practice model for the world. For Pressbreaker News, I'm 5K Chuck.